Hello guys, welcome back to my YouTube channel Rahul GPAT Academy. So today again I am going to discuss one more important topic for PGCET point of view, pharmacology. Actually, I thought I will upload whole pharmacology in one video, but it's quite impossible. So in this video, I am going to discuss regarding general pharmacology as well as and cholinergic system, nothing but the parasympathetic nervous system. These two only I will discuss. In next video, I will discuss remaining pharmacology most important topic. Okay, because it's quite impossible to discuss all the things in a video. So I will discuss only important things as per my knowledge. Okay, so stay tuned. Okay, so first we will discuss regarding general pharmacology. Already I have uploaded one video regarding general pharmacology in my YouTube channel. You guys can check it once in playlist like GPAT on playlist is there. From that you can like watch the video. For in general pharmacology, I have discussed all the things from general pharmacology. You guys can go there and was there. Okay, so here you have to know regarding different scientists and their contribution, like who is the father of pharmacology. Now Oswald Smithberg. Who is the father of experimental pharmacology? Rudolf Buchin. Who is the father of modern pharmacology? Barnard. Who is the father of chemotherapy? Paul Ehrlich. Like this way you have to remember all the things. Father of Indian pharmacology, Arun Chopra. Father of Indian pharmacy education, Emil Straub. This was enough. Okay, so you have to remember these things. Now we are going to discuss regarding pharmacokinetics. And pharmacology is nothing but the branch of science that deals with the drug. Nothing but the drug are those substances which are used or intended to be used for the treatment, mitigation, prevention or cure of the ailment or diseases. That's it, the drug. So here we need to discuss regarding pharmacokinetics, pharmacodynamics. Pharmacokinetics nothing but the movement of the drug throughout the body, and pharmacodynamics nothing but the what the drug does to the body. That's the definition. You don't need to remember all the definition. A few times they used to ask regarding pharmacokinetics, what is pharmacokinetic, what is pharmacodynamic. So that's why I am discussing this point. Now one more important point: volume of distribution. In biopharmaceutics, I have already discussed what is volume of distribution. Volume of distribution is about a theoretical volume that relates amount of drug in the body to its plasma concentration. Okay, so definitely we are going to get one question from this volume of distribution, either in pharmacology or BPPK portion. Okay, definitely. If BPPK one question is there, it will be there from like calculation part, that one volume of distribution equals to x by c. What is C? Plasma concentration. X nothing but the administered dose. That's the volume of distribution equation. Okay. And volume of distribution, high volume of distribution means extensive tissue distribution. High volume of distribution means extensive tissue distribution. This point you have to remember. Okay. Which drug having highest volume of distribution? Now chloroquine. Chloroquine. This question I already discussed in my YouTube channel. I have posted one MCQ like which of the following drug having highest volume distribution? Chloroquine. How much? 1300 liter per kg. Next, one more important point: bioavailability. Bioavailability is nothing but the amount or fraction of the drug that reaches to system circulation in an unchanged form. In unchanged form. Okay, that's nothing but the bioavailability. And bioavailability usually depends upon two portions. Nothing but the fast pass metabolism as well as rate of absorption. Indirectly proportional to fast pass metabolism. If fast pass metabolism high, means bioavailability will be low, and directly proportional to rate of absorption. If rate of absorption is high, means bioavailability will be low. Bioavailability also will be high, directly proportional. So you have to remember for the drugs which shows high fast pass metabolism. These are the drugs like nitrates, hydrocortisone, lignocaine, propranolol, salbutamol, and morphine. These are the drugs which shows a high fast metabolism. Okay. Next important point is metabolism. Metabolism is nothing but the biotransformation of the drug from one form to another form. Maybe from product to active drug, active to inactive metabolite, inactive to active metabolite. That's it. Okay, you have to remember this chart. Different products. Under metabolism, you have to remember 2 points. One is enzyme inhibition, another one is enzyme inducer. Enzyme inducer means it will increase the metabolism rate of increase rate of metabolism will be increased due to enzyme inducer. You have to remember the example of enzyme inducer like glycosylphosphine, phenytoin, rifampicin, smoking, carbamazepine, and phenobarbital, GPRS cell phone. I took these two from a review of pharmacology by Sparsh Gupta, one of the best book for pharmacology, I think, after KT Tripathi. You guys can refer. So this much enough from metabolism. Another one is enzyme inhibition. Enzyme inhibition, nothing but the enzyme inducer will increase the rate of metabolism, and enzyme inhibition decrease the rate of metabolism. Okay, for the example, vitamin K cannot cause enzyme inhibition like valproate sodium, ketoconazole, cimetidine, ciprofloxacin, erythromycin, isoniazide, as well as grapefruit. Grapefruit, okay, angur, angur. So this grapefruit also shows enzyme inhibition. So try to remember this point. Next, regarding cytochrome P450, one of the example of like enzyme family, you guys can read. Already I have discussed in that video like general pharmacology. Please go through that one. That's more than enough. Now we have to remember this product and its active potential like levodopa, dopamine, enalapril, dipeprin, epinephrine, proguanil, cycloguanil, becampicelline, ampicillin, prednisolone. From this one, you guys can get one question. Okay, so try to go through this one. Next, we are going to discuss regarding like clinical trials, phases of clinical trials. From phases of clinical trial, definitely you are going to get one question. It's very important. Different phase, total 4 phase mainly. One more phase is there, phase 0. Phase 0 is nothing but the micro dosing. That nothing but in low dose, 1/100 dose you have to take in a small population up to 10, less than 10%, 10 members. Okay, that's the phase 0. Now phase 1. Phase 1, in phase 1 you have to study regarding pharmacology and safety. Phase 2, therapeutic exploration. Phase 3, therapeutic confirmation. Phase 4, post marketing surveillance. How we have to remember? If we remember like second, you can remember like second. How? Now S for safety, first one safety, second E for second one exploration, third C for like confirmation. Okay, second, like this way you can remember, and last one obviously post marketing surveillance. Okay, post marketing surveillance. In this point you have to remember like geriatric patient should be included in phase 3. Geriatric patient should be included in phase 3 study. Okay, before phase 3 you have to do IND also apply, you have to apply. Okay, so this was enough. Before that, you from general pharmacology you can more, if you want you can study regarding TDM, one of the most important term. TDM, therapeutic drug monitoring. It's very important. Why you need to do it? If the drug having narrow therapeutic index, like we used to do TDM for lithium, for lithium. Okay, try to remember this one. Lithium, for lithium we have to do therapeutic drug monitoring. Okay, now we have to go regarding ANS. We know that nervous system is divided into two parts: CNS, ANS, CNS, PNS, VPNS, and CNS again divided into ANS again divided into sympathetic, parasympathetic, sympathetic nervous system, parasympathetic nervous system, under parasympathetic nervous system, cholinergic. Why? Because the main neurotransmitter or principal neurotransmitter in parasympathetic nervous system, nothing but the acetylcholine. A different receptor. You have to remember the receptor like NN, nicotine receptor, muscarinic receptor. Nicotine two types: NN, NM. NN present location at the medulla ganglia. NM neuromuscular junction or muscle end plate. M1 stomach, M2 heart, M3 GIT, eye, bladder, blood vessels, glands, etc. Okay. From this, M1, M3, M5 is inhibitory, and sorry, M2, M4 even number, even in inhibitory, and odd number excitatory activity. Okay, that's it. Now you have to remember cholinergic drug. Cholinergic agonist means directly acting. What are the example? Acetylcholine, all the coal attached drug. Okay, carbachol, methanol, carbachol, methanol, all the are nothing but the directly acting cholinergic drug. Okay, directly acting cholinergic drug or cholinergic agonist. One more drug is the anticholinesterase, means it will degrade the cholinesterase, which will degrade acetylcholine. That's the nothing but the anticholinesterase. Again, it will be divided into two parts like reversible, irreversible, reversible, carbamide, non-carbamide, carbamide, nothing but physostigmine, pyridostigmine, diphostigmine, neostigmine, and non-carbamide, galantamine, hydrophonium, donepezil, tacrine. These are things are there. And again, one more class is there, irreversible. In under irreversible carbamates as well as organophosphate. Carbamates under carbamates, carbamide, propoxur, and organophosphate like diflos, ecothiophate, melatonin, parathon, diazonal, tabon, serine, so on. All the example of organophosphates. Okay. One more important point from this parasympathetic nervous system is myasthenia gravis. Very important. Myasthenia gravis is one of the example of autoimmune disorder. What is the main reason behind this? The depletion of NM receptor or depletion of NM receptor at the muscle end plate. What is the diagnosis test? You have to remember this one. Very important. Amyloid test, hydrophonium, and provocative test, D-tobocurarine, PT-SAR. PT-SAR, provocative, T, T for tobocurarine. PT-SAR, you know na PT-SAR, and amyloidotic hydrophonium. Okay, amyloidotic hydrophonium. And treatment, hydrophonium as well as neostigmine. This neostigmine is the drug of choice for myasthenia gravis. So this was enough from like general pharmacology as well as ANS system or nothing but the parasympathetic nervous system. Please go through these two or three slides properly. I think you guys will get minimum 3 to 4 questions from this 2 or 3 slide. 100% guarantee. Thank you so much. Please like, comment, and subscribe, and share with your friends. Please subscribe my YouTube channel to get more important videos for like PGCET or other competitive exam like GPAT, NIPER, as well as RRB and other competitive exam. Thank you so much once again.